Fantastic. I mean, there's so much to take on, isn't there? So much to think about. Sometimes it can be overwhelming. I think this is what we're trying to do, is just give you a chance to navigate through all these changes and opportunities. But I think what you gave us was an insight into how we're going to cope and also thrive on these changes. So perhaps, in your view, you speak to a lot of companies. We've got some list questions here. How do we see technologies as AI transforming healthcare in the next 5 to 10 years? I mean, I know you focused on healthcare, but what's your view?
So, artificial intelligence will inevitably span almost every part of the healthcare value chain, customer journey, and so on and so forth. It's inevitable that it's not going to be woven into every single thing, basically, that we touch, do, etc., etc., etc. For my part, basically, the most disruptive thing that artificial intelligence can actually offer us from a healthcare perspective is that predictive healthcare. That's it. I mean, ironically, we kind of saw the same kind of movement actually in the insurance sector. I mean, what would you rather do? Would you rather have the heart attack and then have the heart operation in hospital and the whatever it is, 2-week recovery, 3-week recovery? Yeah. Or would you actually rather be forewarned that there are particular things going on in your body, basically, which mean that you are going to have a heart attack, say, for example, in 3 months' time? And you can make the intervention, you can go to the GP, basically they can sort of check you out or whatever it happens to be, or you can make the change in lifestyle, for example. Yeah. I mean, who would prefer to have the heart attack, hands up, who would prefer to not have the heart attack but be told that they might? There you go. And yet the whole healthcare model at the moment is pretty much based on that reactive, so you've had a heart attack, welcome to the hospital.
I think it's really, just because of technology, changes was, if you have a bump or a lump, go and speak to a doctor. Of course, you should do, but it would be much better to not have anything showing and really understand at a much earlier stage. And that's really where the type of fountain life comes in. And also, you mentioned insurance as well. Yeah. Insurance, they reckon they can reduce the insurance cost by 2/3, and they're putting the money where their mouth is, because we've actually set up an insurance company in America as well, which is basing the amount of policy fees based on the criteria of being scanned by fountain life, because it's so accurate.
But it's like you said earlier, for example, why do we actually go to the doctor once we're ill? Because most doctors basically go, okay, so you're ill, how do you feel normally? You can be like that all the time. Yeah, so Google, for example, basically has got a project, it's part of the Cell Atlas project under Vitality, where they're trying to actually establish what a good human health baseline looks like. And then as you start deviating from that, we can do some things. Like Stanford. Stanford have got artificial intelligence woven into a smartwatch. And in their particular case, they're measuring your vitals kind of every minute, every day, that sort of stuff. And as soon as your vitals, like your galvanic response, your temperature starts changing, they can go, we've noticed that your body temperature has started changing. Therefore, we think that you're going to get ill, or we think you're getting ill, but we're catching it 2 weeks before you get ill. And then basically they sort of hook you up with a telemedicine doctor and everything else. It goes, right, okay, it does look like you're getting the flu. Here's a prescription, or go and have a rest, whatever it happens to be. That's it. So actually, one of the things that I think is massively underestimated basically within healthcare is actually having that baseline. All our baselines are very different. But why do we keep going to the doctor once we're ill?
Yeah, and that's why we think about, for your fountain light, our home clinic, because that's going to be the first stages. By taking bloods and phlebotomy, you can get, it's a very low cost access route to some fundamental type of baselines already, and then from then on you can move on. So again, that's really, really important for us. And this is, as these technologies change, of course, the skill sets required within healthcare is going to change as well. That leads us back into Newcross. How do we create that environment that allows us to place the right type of staff? And of course, they need the training, and I've got future you for the training. But then there's the technology around the actual whole way that we interact and we provide work. one of the things that the hospitals want to do, and we talk about this quite a lot, is the virtual wards.
Yeah.
Which are working quite well, aren't they? But the problem is with virtual wards is that you need to have a very flexible workforce for that to work. So, I mean, in terms of productivity, how do you see productivity generally within organisations like ourselves? You mentioned it before. If you give us some feedback there.
Yeah. So when we have a look at productivity, so it's kind of broken into two. So you've got workforce optimization, which is simply the right person in the right place at the right time to do the right task, job, or whatever it happens to be. So when we have a look at things like workforce orchestration, basically that's really a systems sort of, I say issue, challenge, whatever, but that's matching the right people to the right thing. But from a productivity perspective, though, I mean, if you imagine basically most doctors' appointments, right? The first thing they do is they go, okay, so tell us what's wrong with you. And let's face it, how many regular people know how to adequately describe what is actually wrong with themselves, basically to a doctor? Because a doctor can go, okay, you've got a headache and a high temperature and you've got earache. So you've probably got, I don't know, flu, whatever it happens to be. But the person basically is actually not mentioned that they've actually had, a recurring bowel spasm or something. And the doctor goes, well, if you'd actually told me about that, I think that I actually would change my diagnosis, right? So when we actually have a look at productivity, again, this is where we can sort of map in, quantified self, less so predictive healthcare. But the more information that we're able to provide basically to healthcare providers and practitioners, as long as it is accurate, as long as it's timely, all these kinds of things that sort of Martin alluded to earlier, all of a sudden the doctor can say, well, based on, tell me how you feel. Well, I've got these 3 symptoms. Well, actually, I can see basically that your heart rate is elevated. I can see your blood pressure is up. I can also see that you've got some arterial fibrillation stuff going on and everything else because I've got more information from your body. I've also got some information from your vocal biomarkers as well because, I've got an AI that's listened to your voice pattern that's changed. So actually, I think you've got COVID or something. So the more information that we're able to provide really more to the doctors and the practitioners, the quicker they can actually diagnose what they think the problem is, the faster they can actually provide a treatment for that, which then boosts productivity.
You're so right. And, a lot of times, the diagnosis is going to be based on the cognitive and verbal ability of the patient, and also the mindset. So, my granddad went to the doctor, he was not very well. The doctor says, how are you? He says, oh, not bad. Not bad. He was really ill. I can't grumble. He forgot why he was there. So it's really, really important. If you had a third party, can I just have a look? It takes all the detail. Okay, we need to just have a look at this.
But even language barriers, So, for example, when we have a look at the NHS, I think, sort of mentioning 180 kind of different countries represented in the NHS. I've been to doctors before, basically, that, you can see them, they've got broken English. And you can sort of talk, say, fluent English. And they're sort of going, did you mean this? No, I meant that. No, did you mean this? No, I meant that. So even when we look at language barriers, but one of the beauties of data of having data is the doctor, irrespective of what language they actually speak, provided they've been adequately trained, can go, you don't need to tell me what's actually up with you. I've got all this stuff here. You can augment this information here. If you want to tell me something as well, then go ahead. I've got a lot of information here and I'm already coming up with a diagnosis. So it again brings it back to, the more data that we've actually got, the better informed basically we can all be, and then...
Absolutely right. And I saw this type of language model, like a large language model working, which is real-time listening and converging in any language that you want to. So you could speak to someone in Chinese, they could be Chinese, you speak English, and it converts your voice to Chinese. But not only that, it creates your style of voice to Chinese. So you're not losing part of you. It's absolutely incredible. And that's being developed now live, and you can just have a feed in your ear and you're talking to someone from any country live.
Yeah. And that's so there are lots of different things that we can actually bring in to improve patient outcomes, improve patient care, while also improving productivity.
I mean, one of the big things, and I know there's people in the audience, and I think we see and read a lot of news, and you mentioned this before, what are the key things that we should do to make sure that we are still relevant in the workplace moving forward? All of us, including CEOs. Doesn't mean I can't be overtaken by AI as well. You know? So, quite a good idea for some people. Quite like that.
Yeah. Well, Jack Marbus has already said that technology can automate the CEO. That's it. So, I mean, I can face a future basically where I'm automated as well. So, on the one hand, basically, the sort of advice that I would give is, how many of you as children, basically, when you were being brought up, your parents went, you are the most special person in the universe. You can be anything that you want to be, right? Every one of us was told that. Oh, can I be a nurse? Yes, you can be anything you want. Can I be president of the United States? You can be that, yeah. However, as we sort of go basically through life, basically, society and education typically shape us from you can be anything to you can be this one thing that you think that you wanted to be at the age of 14. And then once you have that one career, that is you stuck for the next 50 years. You come in as an accountant, you exit your career basically as a senior accountant or a partner. So when we actually have a look at automation, so firstly, realize basically that you're actually incredibly adaptable. Right? Secondly, realize basically that everything that you have actually achieved, everything that you are, basically you've actually learned it all. That's it. So from a futures perspective, I would always suggest, firstly, get a point of view. So what I kind of try to do is say, look, there are all these different sort of stars circling above us. They all represent different sort of parts of the future. Get a point of view, like we have here. So get a point of view. Figure out what it actually means for you. And then get a plan. I mean, how many of you actually have a 5-year plan? No. Right? And yet, how much do you think the world is going to change in the next 5 years? Given on how much it's already changed in the past 5 months. Okay? So get a 5-year plan. Now, when we have a look at this, basically, when we talk about organizational strategies, we say organizations should get a point of view of the future. Their foresight teams should then craft the scenarios. And then kind of as the CEO, you go, I like this scenario because it fits with whatever we're up to. And then you develop a strategy around that scenario, and then that's your future operating model. Okay? So as a business, businesses will look at the future, figure out what future they like, and then go and transition to that future. How many of you do that as individuals? Now, part of the problem that we have as individuals is as companies, you've got giant foresight teams, professionals who do this all the time, and resources. As individuals, basically, it's very difficult for us to actually see the future of our individual profession. And even if we could see the future of our individual profession, we don't then really know what that means for us. We don't know what we're going to transition to. And even if we did know what we're going to transition to, what our future other career might be, we don't know where to get the support. We don't have the resources. We don't have the time, the bandwidth, because we're all busy. Which then means we're just waiting to be the out-of-work farmhand. But this is where, as individuals, we can kind of take control. And with the help of companies, these are the training plans. So today we say, right, this is your career today. We think that in the future, your career could look like this. Yeah. And here's the training plan, and here's the resources to go along with it. So we have been adaptable as a species for, 5 million years? We are the most intelligent beings in the entire universe. If I said, you're here today, and your future career is here, even if you don't know what the transition looks like, are you telling me that you can't find a community of people basically that could actually help you say, well, if you do A, B, C, D, and E, you move from here to here? Like the Accenture example I said, 17,000 positions made redundant. 17,000 people moved. Not a single person made redundant. We can do it. It's a training problem.
So that's the skills. What about mindset? They're the type of skills that we need to focus on and look at. But what about the mindset of people? Because I think the mindset has to change for a lot of people, and that's just because of how we've been brought up, our education.
Yeah.
What about that?
Okay. So from a mindset perspective, how many of you are actually alone? Right? You've got a community around you. Okay? So the first thing is, Yeah, when we have a look at the future, basically, you aren't in this by yourself. You are in this with a collection of other people. You're in it with the rest of society. So you've got people that you can lean on, right? But from a mindset perspective, the news networks especially say AI is going to automate you and kill you. It might kill you, then automate you. Right? That's typically the message that we get basically from all of the different news networks around us. Everything has two sides to it. Okay. AI is going to automate you. But AI is going to give you access to every skill on the planet and all knowledge. Which one are you looking at more? From a human kind of flight or fright response, you're looking at the AI's coming to get me. You're looking at the threat. And you're trying to figure out how you deal with the threat. When really what you should be doing is looking at the opportunity and thinking, how do I actually maximize the opportunity? But that again is difficult because the way that we are educated, the way that we're brought up is we are locked into this sort of, this linear view of I start my career here and I end my career in a logical path. But if you look at the opportunity, if we look at Google, for example, how many of you use Google? Yeah. Is it useless? Have you found it useful? Has it helped you? Yeah, it's technology. AI just is that next level. But actually it helps you more. Like my son, at the age of 10, basically wrote a book in a day and illustrated and everything else. We then actually started selling it for charity. We made $25,000. Now, if Caden said that he wanted to be a novelist, I could say, well, you're going to be automated by a novelist. Yeah, but we turned it into an opportunity. Don't look at the threat, look at the opportunity.
Look at the opportunity, look what Martin showed us. So say someone says, listen, I've got these great ideas, but I'm not very good at pitching. But, you give me I can make this work. I'm just not that type of person to pitch. Look what could happen. You could write a great pitch and let your digital twin pitch for you. It's much better. That's just incredible. That's an incredible thing. I think one of the other things we need to think about is that our whole mindset, we are used to, and we're brought up with, especially the media, to look at always the negative because that's what sells. That's what gets us alive. That gets our attention. It's fear and negativity, and so everything's focused towards that, and not about the positive things as well. We're not saying that there aren't issues with AI, but I think we must focus on there's so much opportunity. And I think, we just got to embrace that, really.
Well, that's it. But you also have to be realistic. There are real threats, but similarly, there are real opportunities. And from a mindset perspective, it's then down to you how much time you spend looking at the threat and focusing on the threat compared to how much time you spend focusing on the opportunity. And if you're focusing on the opportunity, but you're not sure what questions to ask, what the answers are, that's where you can either reach out to the community and say, I've seen this opportunity, but I'm not sure how I actually maximize it, how I make use of it. Have you got an idea? Someone in your network, your friends, will go, well, why haven't you actually had a chat with Brian? Because Brian's actually done that. Yeah, and even if you don't actually have a community or a network, ask people online. You go to Reddit. Say, I've seen this as an opportunity. I'm here today. I'm seeing this as an opportunity. Has anyone got any ideas basically what I could do? Oh, I've got some. You ask.
Yeah. And I think GPT-4, you've got to use it later. But I think the opportunity is there where you can just open up GPT-4. You don't know anything about it. Say, I don't really know what I'm doing. Tell me how I could get to know some of your capabilities. And to start to train you. And so, well, could you create a training program, as you said earlier? And all of a sudden, you're curating your own training. And one of the things we need to look at as an organisation is everyone has to be active learners. Really focus on what you need to learn and how you're going to develop as individuals. Because we can support you, but it has to be something that comes from within.
Yeah. And one of the sort of interesting problems basically I actually see with students as well as basically with adults alike is we've kind of established you've got access to all the world's knowledge and increasingly all the world's skills, okay? Right. So how many of you there's a really basic level to sort of produce an example. How many of you are fantastic artists? No. How many of you would like to be a fantastic or a good artist? Hands up. Okay, right. So I'm a crap artist, okay? So I couldn't do that. All the images you've seen sort of ticking by, I used Midjourney. It's an artificial intelligence. It's text to image. So in this one, I wrote in text saying, a caveman in a cave looking at a smartphone. And it produced this. Right. Now, when we have a look at the use of these different tools, on the one hand, you need to understand what they are, that they're available, how to use them, and everything else. But from a mindset perspective, I could sell that. I could put that on Shutterstock, along with all the other ones, basically, that you've actually sort of been seeing. And this is sort of where, on the one hand, you need to know what questions you're actually asking. So if I said to you all, go on to Midjourney and use text to create an image, I guarantee that after about 5 or 6 images, once you've done pictures of your cat in a funny position or whatever it happens to be, you will run out of ideas. Okay? Same with ChatGPT. And what this brings us to, basically, is most of us have lost the ability to be creative. Most of us have actually lost a sight of our own massive transformative purpose. If you have access to a system that can create any image that you want, if you have access to a system that has almost all the answers for all the questions that you have, I guarantee after about asking ChatGPT 5 questions, you're going to start wondering what you need to ask next and you're going to get stuck. Because creativity, imagination, and these kinds of things have increasingly been baked out of us post-school. And so one of the things you really need to understand, which comes back to self-transformation, is what do you care about? What are you passionate about? What do you want to use these tools to do? If you can use ChatGPT, for example, to create lesson plans for things, what lesson plans? What do you want to do? What's your purpose? What's your mission? Like an individual business. Yeah? And that's the thing. So I would actually encourage you to go and explore basically with these tools and everything else. And if you get stuck after asking these things 5 questions, you actually probably need to sit down by yourself, like that video I showed earlier, and think, what is it that you really want to do? You have access to all this stuff. What do you actually want to do with it?
It's a bit like sometimes being in a supermarket, isn't it? You go and choose something, and you've just got all these choices. I just want tomato ketchup. That's all I just want.
Yeah, that's it.
You've got something.
Choice overload.
Yeah, choice overload. And I think that's it. And I think also the fact is that we haven't had the opportunity because we couldn't make any changes and learn in the way that there's, and still work. We probably switched that off. And we've got to switch that engine back on again now. And think about, okay, I'm going to surf this wave. I'm not going to be crushed by it. And that's the reason why we're here in these next couple of days. That's the reason why you're here. And thank you so much for the presentation today.
Thank you very much.
Super excited. And big round of applause.
Thank you.